This is Senate Committee on Health. Couple of announcements. First of all, we have 25 items on the agenda today, so it's going to be a long hearing. What we are going to be doing today is we're going to be allowing a total of 6 minutes for the proponents and 6 minutes for the opponents. You're allowed 3 individuals that can come up and speak 2 minutes each. We're going to be very, very clear and cutting people off after that initial time period. What I will be asking, if there's a line of anyone who would like to speak on behalf of support or opposition after that, that you come up and only state your name and your position. We do have 3 items that are proposed for consent. Item number 4, SB 123. Item number 15, SB 503. Item number 23, SB 779 are proposed consent items. When we get a quorum, we'll stop and then establish that. At this time, I see Senator Fuller. I believe she's the first individual. Good afternoon, welcome, come on up. We're going to get started with item number 3, SB 115, Fuller Valley Fever. Good afternoon and welcome, Senator.
Thank you. Good afternoon, Chair and committee members. Thank you for the opportunity to present Senate Bill 115 relating to valley fever vaccine research. California has had a significant increase in valley fever cases over the past decade. Reported cases totaled more than 16,000 from 2009 to 2012 and reached a peak of more than 5,000 cases in 2011. During that period, 213 patients died from valley fever. Cases of valley fever have been reported from many counties in California. The highest annual incident rates were in Kern, Kings, Fresno, San Luis Obispo, Tulare, and Madera counties. Valley fever is caused by an air or soil disturbance of coccidiosis fungi, which live and breed within the soil. When the dust containing these spores is breathed in, the fungus can attack the respiratory system, causing infection that can lead to symptoms resembling a cold, influenza, or pneumonia. In the most severe cases, the fungus can spread to the brain. Because there is currently no cure, the fungus will always remain in the patient's body. Valley fever is costly and debilitating, leaving patients fatigued for weeks at a time. Nearly 75% of patients miss work or school because of their illness, and more than 40% require hospitalization. Further, 73% of the cases were inmates who were incarcerated at the time of the symptom, costing the state an estimated $23 million per year. SB 115 is needed to complete research in progress on valley fever vaccine and provide protection for citizens at risk in these areas.
Is there anyone like to speak in support of the measure? Any opposition to the measure? Questions, comments from any of the members? Seeing no questions or comments, unfortunately, we still don't have a quorum. Would you like to close?
SB 115 will help fund research to develop a vaccine for this debilitating disease. Protection from valley fever will spare thousands of people from the incapacitating symptoms of this disease. I have some charts here that shows the number of cases for each of the members on the panel, if they would like to receive this. With that, I'd ask for your aye vote.
Thank you very much. And as soon as we get a quorum, we'll
Thank
move
you.
the bill. There was a clarification. Item number 25 is on consent, not item 23. So consent calendar is 4, 15, and 25. We're going to do item number 1, SB 22, Roth residency training. Senator Roth, welcome.
Thank you, Mr. Chair, members. I'm privileged to present Senate Bill 22. This afternoon, it's a bill to create an additional funding mechanism for medical residencies in underserved areas in the state. As you well know, California will need at least 8,000 more primary care physicians by 2030 to maintain current rates of utilization. It's an increase of about 32% from 2010. Further, only 16 out of California's 58 counties meet the recommended 60 to 80 primary care physicians per 100,000 people. Through some extraordinary efforts, frankly, Medi-Cal has added 2.7 million people since the implementation of the Affordable Care Act. With increased need, public and private plans alike must expand networks and train more doctors to practice in these historically underserved areas. While Medicare pays for the majority of graduate medical education residency positions nationwide, the number of residency positions at each hospital for which Medicare would reimburse the institution has been capped since 1997. To illustrate the problem, California has about 19.36 residents per 100,000 in population, while New York has about 77.13 residents per 100,000 in that state's population. Senate Bill 22 would create a voluntary public-private partnership to fund additional residency positions through the state of California by creating a state-sanctioned nonprofit organization to solicit donations from the healthcare industry to be matched by the state up to a specified budget cap. The bill currently contemplates the cap to be set at $20 million. However, I am continuing to work on a formula that will allow for more flexibility in the state match from year to year, specifically allowing the governor to set that cap on the state match each year during the annual budget process. The residency positions will be primary care positions allocated geographically in accordance with the percentage of Medi-Cal patients treated, so they will go to the underserved areas in this state. We know that doctors tend to stay and practice where they complete their residency training. For example, 56% of family practice residents practice within 100 miles of their training location. Therefore, providing additional residencies to underserved communities will have a lasting effect on improving access to health care. Given the fact that I'm going to continue to work on the language with respect to the state match and the governor's authority to set that match, I'd ask that you ignore the author's amendments that were submitted to the committee. I look forward to continuing to work with stakeholders in the healthcare field as well as the administration with respect to this very, very important issue, and I respectfully ask for your aye vote.
Thank you. What I'd like to do at this time is, now that I see we have a quorum, if we can go ahead and get one established. Bill, don't leave. We're going to establish a quorum? Here. No. Good answer. Call the members, please.
Hernandez?
Here.
Hernandez here. Nguyen? Hall? Mitchell?
Here.
Mitchell here. Monning?
Here.
Monning here. Nielsen? Pan?
Here.
Pan here. Roth?
Here.
Roth here. Wolk?
Okay, we have a quorum has been established. Thank you. Please proceed.
Amber King with the Association of California Healthcare Districts. We represent 28 of the state's rural hospitals and 20 of the state's critical access hospitals. We believe that SB 22 is a critical step towards increasing physicians in the most rural and underserved areas throughout the state, and we'd urge your support.
Thank you. Anyone else in support?
Mr. Chair, members, Tim Madden, representing the California chapter of the American College of Emergency Physicians, in support.
Thank you.
Teresa Anderson with California Academy of Physician Assistants, in support.
Thank you.
Sean South on behalf of the California Primary Care Association, in support.
Thank you. Anyone else? Support? Opposition? See no opposition. Questions, comments from any of the members? We have a motion by Senator Wolk. I believe, Senator Pan, do you have a question, comment?
Well, just I want to thank you, Senator Roth, for bringing this bill forward. This is going to be very important to basically open up a bottleneck we have, because we can graduate as many medical students as we want, but they can get residency training, and then what happens when they go to residency training somewhere else, they're less likely to return to our state. So thank you so much.
And I want to thank you for your help, Senator.
A couple comments I'd like to make also. I'd like to reiterate what Senator Pan said, and agreeing with some of the comments you made in your opening remarks with regard to the number of primary care physicians and the lack of them, especially in the communities of greatest need, rural, inner city, et cetera. And I think we need to do everything we can to encourage them to go to those particular areas, in particular when most of that funding is through the federal government, through Medicare. So I commend you, and you have my full support to make sure we can do whatever we can to help you be successful in moving this forward as we hopefully get it to the governor's desk. So,
Thank you, Mr. Chair.
and with that, we have a motion by Senator Wolk. Senator Roth, please close.
I respectfully ask for your aye vote.
Okay, this is item number 1, SB 22, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, I. Wynn. Hall. Mitchell. Aye. Mitchell, I. Monning. Nielsen. Pan. Aye. Pan, I. Roth.
Aye.
Roth, I. Wolk. Wolk, I.
Currently has 5. That's enough to get out, but we're going to put that bill on call. If we can get someone to move the consent calendar. Senator Pan, moved by Senator Pan. Item number 4, SB 123. Item number 15, SB 503. And item number 25, SB 804. If we can call the members, please.
Hernandez.
Aye.
Hernandez, I. Wynn. Hall. Mitchell. Aye. Mitchell, I. Monning. Nielsen. Pan. Aye. Pan, I. Roth. Roth, I. Wolk. Wolk, I.
Good. And if we can get a motion for item number 3, SB 115, Fuller, moved by Senator Pan. This is item number 3, due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, I. Wynn. Hall. Mitchell. Mitchell, I. Monning. Nielsen. Pan. Pan, I. Roth. Roth, I. Wolk. Wolk, I.
Currently has 5, enough to get out. We're going to place that bill on call. Okay, I believe I saw Senator Liu. Would you like to come up? Your first measure was item number 4. That was consent candidate. I believe we're going to go to item number 14, SB 492. Is that correct?
Correct.
Okay.
Thank you, Mr. Chair. SB 492 would require the Department of Health Care Services to create an informational guide for consumers in the coordinated care initiatives. I will be accepting the amendments requested by the chair. These changes refer to comments 8B on page 6 of the committee's analysis, and I really thank the committee for their effort in improving the bill. A mock-up language has been disseminated by the sergeants. This morning, DHCS informed me that they already have a guide that informs consumers of their rights. However, upon review, there is a need for improvement of what the guide does and does not address. And I look forward to conferring with all interested parties and having a conversation on this matter. That being said, the rollout of CCI has not gone smoothly. The process so far has been disjointed. Consumer confusion is common as those eligible attempt to navigate the program's complexities. Beneficiaries aren't always aware of their rights and are left without clear direction on how to access services or file grievances because informational materials are not consumer-friendly or culturally appropriate. This bill will benefit the state's most vulnerable populations, persons with disabilities and the elderly. SB 492 not only contributes to increased consumer knowledge, but also empowers individuals to utilize the services available through the CCI. So I ask for your support in the bill, and I have witnesses in support.
Thank you. Those in support, please state your name.
Jack Haley. I'm pleased to support SB 492. I'm from Government Action and Communication Institute. We're a nonprofit, and I staff a statewide collaborative of aging and disability organizations. The CCI is a complicated piece of legislation, and the rights of CCI consumers come from multiple sources: state law and regulation, federal law and regulation, a memo of understanding between the federal government and the state government, a three-way contract with health plans, the state and the feds. These rights are spread among those many documents, as well as the various all-plan letters and dual-plan letters that Department of Healthcare Services releases. Currently, the CCI covers 500,000 Californians eligible for Medi-Cal and Medicare. It has the potential to expand statewide when it would dictate the way more than 1 million low-income, aged, and disabled Californians receive health and social services. It's appropriate for the legislature to provide statutory direction to the Department of Healthcare Services to provide these consumers with basic information about their rights in this new and far-reaching program. And in SB 492, the legislature, provides that direction. Thank you.
Thank you. Anyone else in support?
Randy Hicks, Californians with Disability Rights. We are in strong support of this bill. We have questions about CCI and whether it's what its ability and what it's about its quality. That's why we need this language and legislation. When a client or consumer is enrolled, we believe that they should know what their rights of service are and coverage. That is why codifying this bill will not only give the patient, but it's advocate of tool to say that, yes, it's in law that they must serve these consumers. It also makes sure that the quality of service is there. And as a consumer myself, I would like to be able to know when I can appeal or if I need to have service that's not there. And I also want to make sure that there's a lot of consumers who don't understand how CCI works. So this is a very good bill, and we're in very strong support. Thank you.
Thank you. Anyone else in support?
Gary Passmore with the Congress of California Seniors. We're in strong support of the measure. We've been a strong supporter of the Coordinated Care Initiative, and it's very important to have in writing with legislative authority what the rights of the consumers of the program are. Thanks.
Fred Main on behalf of CalPACE, the Association of the 11 Programs for the All-Inclusive Care for the Elderly. CalPACE supports SB 492. We're an option under the CCI and believe that these are important protections for those participants. Thank you.
Sandy Fitzpatrick, California Commission on Aging, in support.
Les Shepard, representing the ALS Association Golden West Chapter. We serve the Los Angeles and Greater Bay Area, and we're happy to support the bill. Thank you.
Raji Prasad from the National Association of Social Workers, California Chapter, and we're also in support.
Chair and Member Sean South on behalf of the California Primary Care Association in support.
Thank you. Opposition? Seeing no opposition, questions, comments from any of the members? We have a motion by Senator Wolk. Chair's, no questions, comments. Chair is recommending an aye. Would you like to close?
I appreciate your vote.
Thank you very
I
much.
vote.
Thank you.
Thank you.
We are item number 14, SB 492, due pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Roth, aye. Wolk. Wolk, aye.
That currently has 6. That's enough. We are still going to place that bill on call. We have some members that are absent. I believe we have item number 18, SB 547, Long-Term Care Assistant Secretary of Aging and Long-Term.
Thank you very much, Mr. Chair. SB 547 is a bill that implements several recommendations from the Senate Select Committee on Aging and Long-Term Care's report, A Shattered System, reforming long-term care in California. This measure does several things. It creates an Assistant Secretary of Aging and Long-Term Care Coordination within the Health and Human Services Agency. It requires the Health and Human Services Agency, under the direction of the Assistant Secretary, to develop a state and system-wide long-term care plan, and it creates the Department of Community Living within the Health and Human Services Agency to integrate the administration and delivery of aging and long-term care services and supports, now distributed among 7 different departments. Our state's current population of residents 65 years and older will grow from about 13% of the population to almost 20% of the population. That's 1 in 5 Californians by 2030. Our state is not prepared for this silver tsunami. After a year of in-depth research and public hearings, the Senate Select Committee came to the same conclusion in 6 different reports over the last 20 years. California's aging and long-term care system is fragmented, almost impossible for consumers, caregivers, providers to navigate. The state's disarray of services and supports also extends to the regional and local levels. The result is inequity in access between urban and rural settings and no coordinated oversight or accountability across programs. When consumers can't identify and access necessary home and community-based services, there's an increase in likelihood of more costly hospitalization and institutional placement. The purpose of SB 547 is to produce better coordination in administration and delivery of programs and services and better communication among program staff, not only within agencies internally, but across agencies. The Assistant Secretary of Aging and Long-Term Care, in addition to being responsible for intra and inter-agency program coordination and collaboration, would be expected to coordinate closely with the federal government to maximize alignment of programs and federal dollar drawdown. Members, this is not a simple bill, but it's a straightforward one. The chart I have provided you, each of you, represents our current aging and long-term care system. It looks like a periodic table. What you see is 112 aging and long-term care programs spread over 20 state agencies and departments. Beginning now to develop and implement a state long-term care plan with goals, strategies, benchmarks, and deadlines will enable California to meet the needs of its growing aging population and people with disabilities in a rational manner rather than response in a crisis mode. So witnesses today, I have Sandy Fitzpatrick, Director of the Commission on Aging, Teresa Frazuzzi, Executive Director of the California Foundation for Independent Living Centers, and Daryl Kelch, the Executive Director of the California Association of Area Agencies of Aging, in support.
Thank you. Please proceed.
The California Commission on Aging is designated by state law to serve as the principal advocate on behalf of older Californians. We support the intent of SB 547 for the promise it offers. Every person in this room faces a 70% risk of needing some level of long-term care in their lifetime. If that is you, will you know where to turn? And will the system provide the support that you or your family need? The critical issues facing our system today are fragmentation, the lack of coordinated oversight, and accountability. That periodic table gives us ample opportunity to start a discussion about collaboration and working together. Establishing a cabinet-level position gives the policies around aging and independent living the prominence they have long deserved. Funding and service silos have been a documented need for years. One example might be residential care oversight that's spread across 4 separate departments, or why are family caregiver services operated out of 2 distinct departments. Personally and professionally, for over 30 years, I've seen families struggle to identify services, comprehend the eligibility on that periodic table, and then determine how to access services. The Commission believes that SB 547 is the answer to address the current system shortfalls and develop a plan to meet the future needs of our consumers, their families, and caregivers. Thank you.
Thank you. Please proceed.
My name is Raji Prasad. I'm from the National Association of Social Workers California, representing over 10,000 social workers in the state, and we're in support of this.
Good afternoon. My name is Teresa Fabuzzi. I'm the Executive Director of the California Foundation for Independent Living Centers, representing 21 centers that serve over 100,000 people annually with disabilities. Currently, California has a fragmented system of services that are offered to people based on age, diagnosis, or disability. If you're not the right age, or you don't have the correct disability or diagnosis, you can find yourself stranded. What we need to develop is a system of services from birth to death that meet people's access and functional needs. If a person needs a ramp in order to remain living at home, it should not matter how old they are or what health issue caused that need. We should have a system that should be able to assist that person in understanding their options and how to get or build a ramp so that it enables them to live independently and frankly just get on with their lives. This legislation moves us in the right direction. It gets us in alignment with the Federal Administration for Community Living, and it positions California to capture additional federal funds. It's also important to understand that it changes the dialogue, and it puts an emphasis on a multitude of programs by providing a mission and very critical leadership that drives our services toward community living, something that we've been trying to achieve since the Olmstead decision. This legislation has the potential to increase efficiencies through proactive collaboration and coordination of services that will lead to better outcomes for people with access and functional needs of all ages. We respectfully request your support of SB 547.
Thank you. Please proceed.
Mr. Chair, members, Darrell Kelch with the California Association of Area Agencies on Aging. These are agencies that are mandated by federal and state law to serve all of California's older population. Area agencies know firsthand how fragmented this system is, and we have been looking and asking for change for many years now. It's just not the fact that programs are siloed, that services are fragmented, or that even the funding streams come from various sources, but it's also the reporting. And it's all of these issues that the area agencies are just struggling to figure out an efficient and effective way to serve our seniors. We ask that you pass this bill. Thank you.
Thank you. Anyone else in support?
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Thank you.
Rebecca Curley on behalf of the California Retired Teachers Association in support. We believe that this bill will address the fractured oversight and complexity of the administrative spider web or periodic table for long-term care, and it will help make progress towards rationalizing the state's delivery of long-term care services. Thank you.
Thank you.
Rain Hicks, California Disability Rights, in support.
Thank you. Opposition? Seeing no opposition? Oh, opposition.
I'm not really in opposition. I am in support with the men with some pretty profound concerns. So if I may, it's a separate category, and
this may
I'll
help,
make it very short.
Well, this may help your comments, but what we're going to do with obviously the author's agreement, this is going to be a 2-year bill. This is a pretty large undertaking with all these different agencies that we need to take some time to work and figure out how it's all going to.
And that was exactly my request. Thank you very much. That was too easy.
I answered your question.
Way too easy. Thank you.
All right, so this will be a 2, but a commitment from me and my staff to work with the senator to try to work out all those details. Any other questions or comments from any of the members? Yeah.
Just a very brief comment, Mr. Chair. I want to thank the author for taking this on. Long overdue and difficult, but I hope that you'll be successful, and I would like to be a co-author on this.
Great, you can help us.
Thank you.
We need all the help we can get. Thank you.
Thank you. And seeing no other questions, Senator Liu, would you like to close? And again, thank you for all the work that you've done as well.
No, and we look forward to the further discussion and look forward to trying to smooth out all the issues that, yes, it is a complicated situation that we have created here in the state, and even though what we want to do is pretty simple, it's we've got lots of things to look at. So I appreciate taking extra time to get it right.
Thank you. And then you have one more bill